rural practice is definitely on my radar, even Lismore especially, after being here and seeing what the lifestyle is like. It's definitely something where I didn't ever think I would be interested in. I now can definitely see myself working and living in this environment.
We've got a new facility, a brand new teaching hospital here at Lismore with state-of-the-art facilities, particularly the emergency department and ICU and renal department, and that's eventually all departments will be brand new state-of-the-art, and that's a great facility. There's more room for students to go, there's places to have small group tutorials. So your teaching here is not just based in a campus, you're at the hospital. Everything's around the hospital, and we're at the campus. We're actually right outside the hospital. We're just across the road. So you feel that you've all of a sudden part of the medical community. You're learning to be a young doctor, and we pride ourselves that you will become an excellent doctor in the future.
The academic support that we get at the University Centre for Rural Health and Lismore-based hospital is fantastic. It's multifactorial. We get clinicians that come across the road to the Centre for Rural Health to take us individually through our PBL type scenarios. They're called CRSs in 3rd and 4th year. The student-teacher ratios are really good. The consultants have time to spend with you, and they'll actually take you through concepts and difficult or complex cases and kind of teach you exactly what you might need to know for those situations.
The support staff that we have here at UCRH are really wonderful. They've been really helpful at solving any problems that I've had, and I know some of my fellow students have had, moving to a rural area, moving out of home, all those kind of teething issues. They've really helped work through those. Very aware of everything that we need to do and helpful at keeping us on track. So the support that we get here is really great.
So in terms of my educational experience here, UCRH has been pretty amazing in terms of they'll put on tutorials for us, they'll put on lectures for us. We have lots of simulations with mannequins for like emergency type situations that have been really, really good, and not something that we would have gotten in Sydney, especially not in such a small group, in such a kind of a safe atmosphere really to ask questions and get things wrong, but then be taught things, and yeah, it's been really amazing.
So the dimensions of our program are built upon that ethos. Certainly a strong emphasis on the academic content of the program, but also on issues of disadvantage. We run a series of evenings throughout the year which look at social disadvantage and how we as professionals, health professionals, can respond and can influence people's circumstances in that situation. There's strong themes around Aboriginal health, around rural health obviously, and the involvement that you have with the communities that you will live and work with in the future. It's our great privilege to have you here, and I know, and having seen a number of groups come through over the last number of years, how well they respond to the situation here and how well they develop through that time that they are here.
If I could stress anything, it's the patients really want you here, the consultants really want you here, and the academics who work here really love to make sure the students get a good clinical experience. You're not sitting in the corner as a medical student, you're included in the team.